Welcome to H&HN Daily. I'm Suzanna Hoppszallern, Senior Editor for Hospitals and Health Networks magazine. In Frontier, Idaho, Clearwater Valley and St. Mary's hospitals and clinics are using mobile robots and telemedicine to provide cost-effective specialty care. Today, I'm joined by Casey Meza, CEO, and Dr. Michael Meza, Director of Telemedicine, to discuss telemedicine, how frontier leaders are growing coverage and coalitions. Welcome, Casey and Michael. Thank you for joining us today.
Thank you, Susanna.
What recommendations would you give to other hospitals that are interested in setting up a program?
I think the first thing that anyone needs to do is just identify where they're lacking resources in their community. For us, psychiatric was definitely an area that we knew we were lacking. We had recently lost some services through health and welfare. The physicians, of course, are the best resources of knowing what they're struggling with as far as access to referrals, wait times when they're calling specialists. So certainly working hand in hand with the medical staff is imperative. Having just an awareness of what your community is struggling with. For us right now, oncology is probably the next area we'll be looking at moving into, because right now for a patient to have to travel at least 1 hour one way to receive infusion treatment is simply too far. A lot of our folks are disengaging from their families for a week at a time, living in a hotel room to receive those services at a time when they need the most support ever in their life. So again, being able to connect with oncologists who are willing to help support delivering those services in our community is a next venture we're going to try to embark on. So really just looking at your community and seeing where the gaps are.
I usually tell patients and families that the best scenario is one-on-one specialist handling that care in our communities with that patient. And frequently that's not available in the rural setting. Sometimes those physicians are very busy to really be able to come out on a timely basis to see those patients. And having our patients have to travel so far, or how remote we are, is very difficult. And many times they do opt out of care. But being able to have that accessibility via telemedicine has been really very supportive for everyone involved. You just have to identify your partners. Frequently, what you can do is actually build upon the relationships that you already have. If I have a specialist in Spokane, let's say, that is very interested in supporting our endeavors in our community, then they can add on or supplement their care through telemedicine. Sometimes those physicians will, again, retire or move or just plan to do something different. Doesn't mean the program has to cease. We can supplement that or add new partners to the equation with telemedicine. There are physicians out there in our state that are willing to participate and really want to come on board and help these folks out in the rural setting. So just finding those correct partners with the right goals and the right energy level to make things move ahead.
What about emergency medicine? How has it changed what you can provide in that area?
That's been a very unique opportunity for us. Certainly we have family practice physicians who are very comfortable taking care of patients in the emergency room. However, infrequently we would get those trauma patients or very, very sick patients that we may have not seen 6 months prior or a year prior. So you need to be certainly caught up in your healthcare plan to take care of those critically ill patients, but it's always nice to have an expert physician in your back pocket, if you will, to have them beam in remotely. An ED physician from, in our case, St. Al's in Boise, to be able to beam in and help us take care of that patient and stabilize that patient and transfer that critically ill patient rapidly to the tertiary center that they will best be served.
What's it meant for your patients in your community to have this telemedicine program?
It's meant access to care. Especially when you look at the elderly patients. You think about an elderly patient coming in having heart issues, and maybe this person's 85 years old. To go 3 hours north to the cardiologist is what is going to have to happen. But those subsequent visits, those very necessary close monitoring of their health, to think about an 85-year-old couple or 86-year-old couple having to drive 3 hours one way on winter roads, it's unsafe. So we have really heightened, I think, the expectations of our community of what they can receive locally. It certainly is enhancing the wonderful work that our primary care docs are already doing. And more importantly, it's really adding to that medical home concept. We're taking our medical home, which is driven by the primary care docs, and they are dictating when the specialists need to come in and supplement the care they're able to deliver close to home.
Thanks for joining us today.
Thank you.